Afternoon, everyone. Welcome to the World Affairs Council Upstate's Supply Chain Series event. Today, we are exploring why global opportunities and the local impact they bring for life sciences is growing this industry by leaps and bounds really here for our region, even during COVID. We are so grateful today for our co-hosts and partners in this event, Upstate South Carolina Alliance, the European American Chamber of Commerce Carolinas, and of course, SC Bio. First of all, I want to tell you just a bit about why this is so important. There are more than 650 firms these days and 43,000 professionals who are engaged in research, development, commercialization of healthcare, medical device, industrial, environmental, and agricultural biotech and products in South Carolina. Yet at its core, and you'll see as we talked about this today, life science very directly affects each and every one of us. It's responsible for improving the quality of life and healthcare for all of us as individuals. Leaders and entrepreneurs across the Palmetto State are making waves around the world with their innovation here in South Carolina, and we're very grateful for the three panelists who will join us. First of all, I'd like to tell you a little bit about our lead panelist, Sam Konduros. Sam joined SC Bio in the spring of 2017 as its president and CEO. He's leading the Innovative Economic Development Organization, an industry association, in its mission to build, advance, innovate, and grow South Carolina's $11.4 billion life sciences industry. Prior to his role at SC Bio, Sam served as executive director of the Greenville Health Research Development Corporation. He was founding president and CEO of Upstate South Carolina Alliance, along with other leadership positions with the South Carolina Department of Commerce. He's the founder and principal of SK Strategies LLC, a consulting firm specializing in economic development, innovation, public-private partnerships, integrated marketing, and business development strategies. And that's just getting us started. Sam also is a volunteer for many organizations here in South Carolina, including the South Carolina Chamber of Commerce Executive Committee and Board, Southeast Life Sciences Association, the South State Bank Greenville Advisory Board, and the Palmetto Conservation Foundation Board. One of the most important things, though, I think we can mention about Sam is that in 2018, he was awarded the Order of the Palmetto, which is South Carolina's highest civilian award. So we really appreciate your time today, Sam. Sam will welcome our other panelists after he speaks to us. Sam?
Thank you, Tracy. I really appreciate the gracious and lengthy introduction. Really excited to be with y'all today. Thank you for the interest shown in the life science industry, to learn more about how it's moving forward in the Palmetto State, with especially highlights about the upstate, which is very, very strong in this market. So at your request, I'm going to give an overview about the industry in the state and how it's moving forward, and try to highlight a number of things about the upstate's position in that. And then I'm really looking forward to three dynamic panelists that you're going to hear from and have plenty of time to ask some questions and answers to. So this first screen just kind of is emblematic of a new era of life sciences in South Carolina. It's actually Nephron Pharmaceuticals outside of Columbia, but facilities like this are taking root all over the state in the biotech, medtech space, et cetera. And it sort of shows that this state is really putting its foot forward in life sciences. I think the next screen is going to just indicate a really important relationship we have with our Commerce Department, and I'm really glad that the Deputy Secretary of Commerce is joining us today, in that we have forged a strategic partnership that is anchored by a memorandum of understanding, and one of the main deliverables of that and their funding support of our mission is the development of the state's first ever strategic plan for how to build, advance, innovate, and grow the life science industry in the state. And that clearly means not just recruiting industry or even supporting existing industry, but building an ecosystem that did not exist in the past, and bring this industry more to the same level of infrastructure as we know it for the more mature clusters of automotive and aerospace. This is my favorite screen because it kind of tells the story and immediately answers the why. If there is a why, would we focus on this industry in the state of South Carolina? First of all, it's a $1.2 trillion global industry that feeds an $8 trillion global healthcare spend. I think when the economic impact study was done about 4 years ago, and some of these numbers are actually 4 years old. So the truth is, we think the job numbers and the annual economic impact is quite a bit higher now. But what it revealed was an industry that even without a major strategic plan formally in place or a really deliberate strategy, this industry wanted to grow here. We had the ingredients for success. And by last count, we have well over 600 life science firms and 6 very diverse segments that represent this powerful industry. And the incredible thing is how well distributed it is around the state. Actually, in 43 out of 46 counties, probably well over 50,000 jobs now. And we expect, because when the first study was done, we counted about 450 companies, and now we know there's well over 600. So we're probably closer to a $13–14 billion annual economic impact. One thing I want you to notice, since we're highlighting the upstate in particular, is look how dense the number of companies is throughout that region, the entire I-85 corridor. And an interesting thing is, of all non-metropolitan counties in the state, the one that has by far the largest life science presence is Greenwood County. And that's partly a tribute to the talent associated with the Genetics Center, Clemson University, et cetera. A lot of folks ask very reasonably, what is life sciences? What do you mean? And what all does it cover? So this is kind of the 6 major segments that we really focus on, starting with biotech, drugs, and pharmaceutical. And you saw that opening screen of Nephron Pharmaceuticals in Columbia. They would be a great example of that. But in the upstate area, Pharmaceutical Associates, PL Developments, there are a number of very strong up-and-coming biotech pharmaceutical companies, Bausch and Lomb, et cetera. Moving over to medtech, so every conceivable medical device or equipment in the medical space that you can imagine. And the upstate is prolific in that area. A great story about Arthrex that had, could have gone anywhere in the nation to build a strong new beachhead for manufacturing an extraordinary portfolio of surgical instruments, implants, et cetera. They're considered really top 3 in the world in that space. And they chose Anderson County, South Carolina, where they're ramping up to 1,000 employees on a beautiful campus there. But Abbott in Pickens County, prolific producer of defibrillators and pacemakers, et cetera. And a lot of innovation has come out of that facility. And then another company that's a great example would be AVX, global headquarters in Fountain Inn. Over 12,000 employees, 20 manufacturing locations in 12 countries. Their capacitors, tantalum capacitors, are the preferred ingredient for pretty much every pacemaker or defibrillator produced in the world. And then digital health. This is an area of explosive growth within life sciences and healthcare, and part of the reinvention of how healthcare is delivered through artificial intelligence and beyond. And there is no better story than the one you're going to hear today about ChartSpan, with their global headquarters in Greenville, and they've become the largest chronic care management firm in the nation. Research, testing, medical labs, diagnostics. This is a really wide-ranging sector in the state, and you're going to hear another great story of Greenville-based precision genetics and how incredibly relevant this segment has been during COVID-19, where gratefully we have a number of really world-class companies like Precision Genetics that are capable and are delivering daily on COVID-19 PCR tests, antibody tests, and it goes well beyond that. Greenwood Genetics would be another great example within the upstate of a major research lab facility. Bioscience distribution. It's more complicated in the world of life sciences because you've got to be able to deliver drugs all over the world and have them constantly monitored and for temperature controls and what have you to ensure they're efficacious when they arrive. So the photo you see there is another great Greenville upstate story, the largest pharmaceutical packaging company in Europe, Softbox, chose Greenville for its Western Hemisphere headquarter right at the junction of I-85 and 185 in Greenville. And then bioag, you know, this is a huge area of life sciences. It stretches our bandwidth a bit, but we work closely with the Department of Agriculture and others to try to promote this large industry for South Carolina. Hampton County just had an announcement of 1,400 jobs, $315 million investment, which is one of the largest announcements of its type in the nation this year. So that's an indication of bioag. Our organization, you know, very simply, economic development is job one, and it's to support existing industry like the ones we're talking about and that are all over upstate South Carolina. It's to be a strong support system for our economic development partners at the Commerce Department, at the regional alliances like Upstate Alliance, that is a co-sponsor of today's event, and even county economic development organizations, and again, GADC, and Greenwood County are both county organizations that are involved directly. Third and last in economic development are entirely new strategies and platforms for how to grow our own South Carolina companies. Workforce and talent is our biggest opportunity, strength, and challenge all at the same time. And we're constantly working on strategies to deepen the talent pool. We are considered a voice for the industry, that any federal or state policies that could chill or become obstacles for the continued growth of this industry, we try to work hand in glove with our industry partners on that. And what's become really important in this era of COVID is having the ability to engage with leadership all over the state of South Carolina at the highest levels and make sure that we're synchronized in alignment and coordinating. This is a recent meeting with several of the top CEOs of our South Carolina life science companies directly with Governor McMaster to talk about unique COVID impacting products, services, technologies they provide across the board. And I think it really encouraged the governor to see truly what was happening in South Carolina. One of the CEOs in that room is Steve Clemens, who's president CEO of VitalLink Research, which is headquartered in Greenville, has sites all over the upstate, and is currently in the midst of doing one of the largest COVID-19 Moderna vaccine studies in the country, with almost 2,000 upstate residents as participants. You know, and in terms of COVID impact on the life science industry, what has been interesting about this industry is it has demonstrated a lot of its recession resistance because it is so intertwined with healthcare. So during an era in which the pandemic was especially hard on aerospace and even automotive, a lot of that just being global supply chain issues, this industry was roaring quite a bit and continued to grow. And frankly, one of the bigger challenges was just how to safely bring all employees into facilities and conduct meetings. And so we're big advocates of wearing masks and social distancing and making sure that science and data are our guide in terms of how to safely open this economy. I will mention in the last screen, just quickly, in addition to the governor, you saw images of the lieutenant governor, Linda Bell, the state's lead epidemiologist, the chair of the Ways and Means Committee, Merle Smith, Representative Merle Smith, Senator Tom Alexander, who serves on a lot of important health committees. So what's been exciting is from DHEC to Health Human Services to the executive and legislative branches of the government, they're all very much engaged and supportive of these efforts. And you do see my alma mater's president, Jim Clements, there too. So we're in the midst of an unprecedented opportunity for repatriation and onshoring of life sciences in this country. Long story short, data that became known to most Americans during this largest public health crisis in modern times was a realization that while the United States remains clearly #1 in innovation in life sciences and healthcare, a vast majority of the products, services, drugs, medical devices, and clearly safety equipment has gone offshore. And we want to bring that back because we don't want to have that level of vulnerability in our global supply chain ever again in the future. I mean, the facts are 97% of all antibiotics taken by Americans are produced in China. Over 90% of all active pharmaceutical ingredients that are essential to every single drug produced is overseas in primarily China, India. So these are things that there are new programs, $25 billion onshoring funds, opportunity zone initiatives, and a number of unique tools that we can talk about more about in the Q&A if there is interest on how we expect South Carolina to be a leader in helping to repatriate and onshore a lot of these life science companies. Telling our story is one of the most important things we can do, as much as it seems to be low-hanging fruit. Most people are just not aware that this state has such amazing ingredients for the life science industry. And so we enjoy traveling around the world to share that story in a non-COVID timeframe and leveraging the fact that our state remains #1 in foreign direct investment. So we strive to be the ultimate landing pad for global firms that are seeking to bring a life science company to North America. And so in a normal year, we are out there with commerce, with our regional alliances like Upstate Alliance, et cetera, and really trying to recruit the next generation of world-class life science companies to the state to really increase the ecosystem around it. A cool point, since we're focusing partly on COVID impacts, is that at our last count, 71 South Carolina companies, you know, the famous word, pivoted or enhanced or expanded their operations in some way to provide direct COVID-19 solutions. And again, you're going to hear from Precision Genetics is one of the main ones that did that today. Other upstate companies, Paramer Scientific, Milliken Healthcare, MedPoint based in Greenville, Vitalink, Biotech, those are all upstate companies that have made major impacts during COVID. And then just some of the iconic South Carolina companies. Thermo Fisher Scientific, this is the one major API, active pharmaceutical ingredient company that is currently located in the state. Used to be Roche, and is an indication of what we would be seeking to bring back. And let's see, and my laptop just went out, but I'm gonna continue. I'm assuming y'all can still see me, and I am gonna just continue forward, although my screen did go blank on me there. So Thorne Research, Arthrex, one of the companies I was talking about a minute ago, in the upstate, growing like crazy in Anderson. And moving on to Abbott. Again, in Pickens County, prolific med tech company. And again, you can flip right through Nephron and Vicor Scientific. Aaron, thank you. And then as I wrap up with a few screens, I want to just try to keep our foot on the accelerator in terms of everything we can possibly do to successfully open our economy while doing it safely and vigilantly. And then the last couple of screens will focus more on talent and workforce. And this is an area that we have to be very deliberate, very strategic in, because it is a lesser known industry. We have less even what I'd call certificate programs, degrees, courses in our technical college, community college system, et cetera. So we're working on building all of that up. During COVID, when so many companies had to lay off folks and the life science industry was continuing to ramp up, we opened up a South Carolina Life Sciences job board. And it's been a great opportunity for a lot of folks to begin new careers there. You see some images of that now. Includes resume databases, et cetera. We can't do this without the research universities and all of our institutions of higher learning. And you're looking at investors in SC Bio directly with all of these research universities, as well as everyone from College of Charleston to Newberry to USC Upstate. And then in the next screen, which also talks about the power of healthcare to this industry, VCOM in Spartanburg, a fourth med school in the state, has just joined recently. We believe in keeping our eye on the patient and making sure that we work hand in glove with the healthcare industry, because basically at the end of the day, we're a solution provider on how to reinvent and transform healthcare. So having a system like Prisma, which is one of the 20 largest healthcare systems in the country, based in the upstate, is a big deal. And not to mention all the other providers from Spartanburg Regional to ANMED and beyond. clinical trial powerhouses. And then I mentioned an innovation platform. So if there's interest to talk about it during Q&A, because it's time for me to wrap up, the cool thing is we have teamed up with some great partners. We have some world-class bioengineering talent on our own team, and we have developed a platform where we're going to begin working with some of the most novel ideas and young companies in our state to help them grow and stay headquartered in South Carolina. This is the power of collaboration. So we're the state affiliate of major national organizations, Biopharma, AdvaMed, but you see top right, the Department of Commerce is our #1 partner in the state of South Carolina, and they really put a lot of wind in our sails through their support, along with all the regional alliances and beyond. And again, gratefully, we were able to almost quadruple revenue in the past 3.5 years because there was pent-up demand, and because this is now the fastest growing industry segment in South Carolina's innovation economy. So it's a terrific diversification opportunity for the upstate and all of South Carolina to complement our prolific automotive, aerospace industries and beyond. Lastly, can't do it without the folks who support it. We have a wonderful multidisciplinary board of directors that is academia, industry, core service providers, economic developers, and beyond. And so it's a bullpen of talent that I am very privileged to get to work with. And that wraps up my overview presentation. Again, if there's some questions, you can fire away during the Q&A, but let's move more importantly to our esteemed panelists. They've got some great storytelling to do with you, and we'll share some perspectives. So I'm going to start with Jennifer Fletcher. And Jennifer, I'm so pleased to get to introduce you today. We have had a long partnership, and you've got deep roots in the upstate as well. You lived in Greenville for a few years, and you were one of those key executive leaders who helped build Upstate Alliance, led all the marketing efforts for so long, served as interim CEO, et cetera. And it's been fantastic to watch the trajectory of your career and the difference that you make in your crucial leadership role at Commerce. So thanks for joining. And if you would, Jennifer, I was hoping you could give kind of a little bit of a statewide overview of COVID impacts to industry, knowing that we're focusing on life sciences, but I think you can give it top line and even some of the unique partnerships and strategies with other agencies like DHEC and the Hospital Association that Commerce has fostered during this time.
Sure. Thank you. Can everyone hear me? Successfully unmuted. Yes.
It's you're a little quiet.
Okay. Is that any better?
Yes, perfect.
Okay. I was trying to use headphones because, like everyone working from home, we have to make adjustments for our pets. And one of mine is, if I don't keep a window cracked, you'll see a cat start walking across my desk. So, anyway, thank you, Sam, for the introduction, and appreciate the opportunity to be with you all this afternoon. As Sam mentioned, what I want to do is I want to talk more broadly about what we are seeing in South Carolina, how COVID has impacted what we do at Commerce, and what we are starting to see now, and where we think that is moving from here. As you can see, I don't need to spend a lot more time talking about the life science industry because Sam has done such a great job of outlining what that industry means to South Carolina. Obviously, all of those companies that are here, the jobs, the citizens they employ, higher than average wages for most of those jobs. That's very important to us. Certainly at Commerce, we want a diverse industrial base for our economy. That is the way we're going to come through a pandemic like this or other economic downturns. So we are always thinking about that at Commerce. And of course, I think we'd be remiss if we didn't recognize that this industry has a very unique and probably personal relationship to all of us, as it has the potential to impact our lives and our well-being. So for those reasons, it is certainly it's an industry that we do focus on at Commerce. But now I want to talk a little bit about where we are today and related to the pandemic. We believe that South Carolina is in a better starting position to move forward after seeing some of the impacts we have seen from COVID, because we as a state were really in a much better starting position than a lot of other states. Our unemployment was at record lows. We had record state revenues. And we had a fantastic and diverse industrial base that is helping us move through here. And we have been busy during the pandemic. I'm going to spend a little bit more time talking about that, but we've been busy. Sam mentioned in his remarks the agriculture technology campus in Hampton, and it's kind of a mouthful, but it's interesting what it is. It's a developer who's come in and put some significant infrastructure in for food production. So temperature controlled, you know, I hate to use the word greenhouse because these are very, very high-end greenhouses, but with that comes food producers who are more what you might think of as a traditional economic development project. So 2 food producers are locating at this facility related to the infrastructure that's being put in place. And of course, the long-term hope is that more producers will come in behind it, and it will also attract South Carolina farmers to be able to provide to the processors who locate. Sam mentioned that's 1,500 new jobs, huge announcement, especially during the time of a pandemic. But we also announced earlier this year Walmart Distribution Center in Dorchester County, which represents another 1,000 jobs. When built, this might be the largest facility under roof in the state. We're still working on verifying that one. And then also our very own life science company, Nephron Pharmaceuticals, which Sam talked about, announced an expansion just a couple months ago, 215 million and 380 jobs. So you can see that even in the midst of social distancing and a pandemic, there is some really good activity going on for the state. And on the unemployment front, some of you may have seen that last week in South Carolina, the unemployment rate dropped from 8.7% in July down to 6.3%. So all very good news. Of course, we still recognize at Commerce that we've still got some work to do, and we are going to continue doing that. Our companies in the state have really been resilient, and they've remained on course. We did have some shutdowns, some partial shutdowns, and some companies just kept on trucking. What we're hearing from our companies today is that production is mostly back to normal. Supply chains have resumed, and companies are now able to get in raw materials, get out product. We are hearing very little today about absenteeism related to COVID. A couple months ago, that was not the case. Companies were dealing with quite a bit of absenteeism. And what we're hearing is that they are very grateful for mask ordinances, and certainly some of the initiatives that DHEC has created to help remind citizens that they are responsible for their own health and need to be responsible for the rest of us as well. I do want to mention during the height of the pandemic, we tracked up to 130 companies that at one point in time were making something related to COVID. I think, Sam, you mentioned 71. I think we've been able to go back and really dig into that number and find some more. Now, all 130 of these are not still producing items related to COVID. Some of them are transitioning back to their typical production, and some of them will keep on going. But certainly that is a tremendous thing that our companies were able to do. So acknowledging the hardships that we've gone through and where we still need to go, we are very optimistic at Commerce, and I'll tell you a little bit more about our activity level. So certainly our recruitment activities, not marketing, but our recruitment activities continued during the pandemic. Like everybody else, they continued in a different fashion, but yet everybody made the adjustments really well. The interesting thing to me, and having been in economic development for a lot of years, is that activity really starting in April has been at high levels we haven't seen in almost 2 years. So in the middle of a pandemic, we are seeing, and what I mean by activity level is that would be a company that is talking to commerce because they're either going to grow or expand within commerce, or they're looking to put a new facility here. So when I say activity level project, that's what we're talking about. So we haven't seen this level of activity in almost 2 years. The other thing I find really interesting is that the project size, and so size for us would be number of employees or capital investment or a combination of both. And so project size has also been increasing, not across the board, but we are seeing more larger projects than we have in the last 2 years. I think maybe of interest to this group is the foreign direct investment versus domestic makeup of our activity level. So what we're seeing is we have really seen no change to that. And typically where we've been hovering is 35 to 40% of our projects will be initiated by a company owned by a foreign parent company. And then obviously the rest of that would be domestic. And we're still seeing those levels today, even with travel restrictions and some of the other challenges that international companies are facing right now. A couple other things about trends that we're seeing. At this time, much has been made about supply chain, and companies are going to have to reconfigure their supply chain. We are not seeing that in terms of reasons for looking at South Carolina. Probably many of you on this call are aware that reconfiguring a supply chain, finding new vendors, is a very timely and costly undertaking. So while this may be a result of not just the pandemic, but tariffs that plagued us last year, we don't anticipate really seeing an uptick in projects for that reason in the near term, maybe sometime next year. However, Sam mentioned onshoring and repatriation. We are seeing a few, I'm not going to call it a huge portion of our new project activity, but we are seeing some companies looking to bring, I'm going to say they're bringing their product closer to the customer. So where they may have had operations elsewhere and importing it all in for the US market, those types of projects are looking, I don't like to say onshoring too much because it automatically, I think for a lot of people, implies China. This isn't necessarily the case with some of these projects, but so we are starting to see that trend, and we do anticipate that that is going to continue. What industries are making up our activity level? At the beginning of this, I mentioned the project in Hampton County that is food related. Food and beverage has been at the top of our industry list in terms of projects for probably a year and a half, or maybe even a little bit longer. And it remains extremely strong and growing. The majority of these projects are related to companies wanting to get closer to the population centers. So many of you know that the Southeast has been increasing in population, and with South Carolina's great transportation network, you can get to very large centers of population quickly. So that's what we're seeing from food and beverage, and that continues. Other categories that have been at the top of our list are plastics, rubber, chemicals, and automotive related. We are still seeing automotive suppliers looking in South Carolina to support the OEMs that are here. And of course, life sciences has also remained steady and in the top 10 of our list. So with all that good news and everything we've got going on, what are we watching? What could slow growth? Obviously, still concerned about COVID. I think all of us are concerned about how long is this going to be with us? What other companies, especially small businesses and tourism related, how many of those are going to make it, and that what's going to happen to our unemployment rate if any of that happens. So we're certainly watching that. Certainly our drive to recruit more and more companies here would hopefully be able to take up some of those jobs. Visa travel restrictions for the short term are certainly part of the issue. So many of you know that there is no incoming visas right now. You have to apply for special exemption. This was put into place by the Trump administration to try to stem any international workers from taking jobs that Americans could otherwise fill while the US unemployment rate was so high at the height of the pandemic. It does expire at the end of the year. We're hopeful the US unemployment rate is also falling, so we're hopeful that those will go away. However, that doesn't mean that other countries are going to start allowing Americans in. So it does go both ways, especially when a company is putting a new facility in South Carolina. A lot of times they want to take our employees to their facilities overseas and train them. So it is going to, as long as these are around, it will slow companies' decision making down. However, I will say that our staff at Commerce has done a lot to work with the US government to determine processes for getting exemptions. And we have been fairly successful in working with a few of our companies to get those exemptions, to get those critical workers in to start up facilities. Tariffs are still a concern. Part of the reason I think we're seeing such a great level of activity this year is pent-up demand due to tariff uncertainty in 2019. But tariffs are still out there. They still exist, especially when we're talking about China. So that is still something that we watch very, very closely. And the last thing that we're really watching right now is the presidential election, not because it matters historically who's been elected, which party, but companies slow down decision making during an election. So when I mention we have a lot of activity, that doesn't mean we're getting a lot of decisions. Although right now we seem to be doing well, but we do anticipate at least kind of the few weeks before the election, possibly some significant slowdowns. But this is not a usual year, so who knows if previous economic development experience will even indicate any of these traditional things that we see. So in closing, I just want to say that I think South Carolina is extremely well positioned. A lot of the indicators are very positive for us for how quickly we've come out of shutdowns and where we're going to go from here. Commerce is going to remain steadfast in our recruitment efforts. We are starting to develop those proactive strategies now in this new environment, working with our partners like SC Bio and the Upstate Alliance. So hopefully that will continue to keep our activities level high. And with that, I'm going to close. And I want to thank you again for having me today.
Thanks, Jennifer. That was a great overview, actually, and a lot of strategic points. And I appreciate even just the authenticity of what the challenges are, what we have to be on the lookout for to ensure a successful recovery of the economy through this pandemic, which is going to be with us for quite a while. So we appreciate your leadership at Commerce. I know there's already a couple of questions that have rolled in, and we'll look forward to getting to those after we have our other two panelists give their intros. So I'm excited now to bring on Nate Wilburn, and Nate's a dynamic guy. For those of you who don't know, he was also a terrific basketball player for the University of South Carolina and the Charlotte Hornets. I'm 6'3", and I look up to Nate that top 7 feet, I think. So sorry, Nate, I just had to personalize this a little bit. I was so impressed the first time I saw you, man. Anyway, Nate has really built an exceptional world-class company in Greenville, and again, has been one of the major diagnostics and molecular medicine companies in the state of South Carolina that has really helped us navigate this pandemic through their support of everyone from Prisma to BMW and providing PCR COVID-19 testing and way beyond that. And I think has also launched a division just to help companies of all sizes and shapes know how to safely operate during this pandemic. So I'm excited to introduce you, Nate, and look forward to hearing your remarks.
Thanks, Sam. Appreciate the intro. It's been great to work with you guys. And as Sam mentioned, Precision Genetics is a molecular laboratory and services provider in Greenville, South Carolina. We're in the process of expanding our operations across the state. We do have operations in Charleston as well, but our primary location, headquarters, and laboratory reside in cooperation with our partnership with Clemson University and Prisma Health. So Precision, prior to COVID, was really focused on changing the way we perform. You guys can go to the next slide, but we focused on molecular sciences and using technology as a way to deliver complex information to providers so they could use genotype-guided, evidence-based medicine to make informed decisions at the point of care with patients. So, our laboratory really ran some lab-developed tests with an acronym that LDTs is what we call them in the diagnostic space. We're launching a very unique and proprietary solution in the perioperative world. And what the perioperative world is any patient that touches anesthesia in the surgery process. And what we were using was the molecular science to pre-assess prior to the procedure a patient's risk centered around exposure to anesthesia and also to narcotics and opioids underneath anesthesia. And then the handoff post-operatively, how do you manage those patients as they get to the PACU? A big reason PACU efficiencies or inefficiencies are drug related. And so if we can cut that off prior to the patient going under anesthesia, we can drive some efficiencies and economics in that space. We were launching that program with 4 of the largest academic health systems in the United States, from California all the way up to Maine, and then COVID hit. So we were very flexible, and the company was able to pivot overnight. We stood up COVID in less than 2 weeks using our instrumentation. In April 3rd, we launched our EUA and our partnership with Prisma Health. Since then, as Sam mentioned, we service and provide testing, both COVID testing and our other molecular sciences for the 6 largest health systems in South Carolina, including MUSC and Roper here in the Low Country, Prisma Health and Bon Secours in the Upstate, and then Lexington Medical Center and Spartanburg Regional. So the thing we really rely on as a company is our technical platform. We think in order to drive the fastest turnaround that we currently offer in the state of South Carolina, is technology is really what drives that. And the ability to be integrated into medical records, the ability for our LIMS to be interfaced with employer, HR platforms, to automate ordering, to generate results and turnaround within hours of receipt at the laboratory, really is a testament to our technology. And so we have tripled in size as far as headcount and jobs since COVID hit. We employ around 20 technicians, molecular scientists, PhDs, that manage the operations of the day-to-day laboratory. We average probably somewhere between 2,000 and 4,000 tests on any given day, and we're in the process of scaling that up to 12,000 to 15,000 to support an aggressive state strategy around testing. Precision recently submitted a modification to our EUA with our new saliva-based collection method. So we're trying to advance and utilize technology to continue to not only support the pandemic, but also to leverage our technology and those lab-developed tests that we've created into these health systems to really drive better patient care. So that's really what our company has been focused on. When we get back to some level of normalcy, whenever that is, and if that is even going to be possible, we're going to go back to what we're really good at, and that's personalized medicine and using technology to drive better employee care. But what COVID has really exposed is we're no longer in the business of just employee wellness. We're in the business of employee and patient safety first and foremost. So we're going to leverage the technology to be able to deliver those types of services to all of our clients. So just to mention a few clients that we do service and provide testing and turnaround for. We work with Boeing across the country, obviously in the Charleston facility. We work with Milliken, Michelin, AFL Telecommunications, and a variety of other self-insured employers. And we're just now starting to roll out some of these other platforms on their behalf to look at employee safety, employee wellness. So you guys can kick to the next slide if you don't mind. So you definitely don't need to see my face on the screen, so you can change that one. So I think the thing that I'm most proud of as the leader of this company is the team that we've surrounded ourselves with. We have a tremendous amount of talented people that work for Precision Genetics. It starts with our chief science officer and our chief medical officer. From a clinical and a science perspective, I would put them at the top of the food chain. Jeremy Stewart, who's got a long history in molecular sciences, both from the manufacturing side to next-gen sequencing and operations of a laboratory. He is really one of the best I've ever seen. He is extremely well-versed in all aspects of the business as well. He's a PhD from Harvard. He has a long history with Sam and some others in the upstate with a former molecular science operation through Sela Genomics. We are very, very fortunate to have him as our leader on the science side and our lab director. And then from a clinical standpoint, John Rangel, who is a medical oncologist at MUSC. John is one of the most talented lung cancer specialists and oncologists in the United States, really globally. John has developed some amazing pharmaceuticals and applications that have been deployed across the United States, specifically to treat lung cancer. John also has a very diverse clinical background and starting from primary care, internal medicine, and a very strong molecular science knowledge base. So John is very instrumental as part of our business, specifically as it relates to research and advancing the molecular sciences that we offer. So we're very, very happy to have John as part of our team. From the lab side, the operations, the people that have really made the engine run, our molecular technicians that operate our lab now at Clemson and Prisma, they have been just instrumental in the efficiencies and the quality that we provide. So there's a leadership team there. Keanu Rill, our lab director, our lab manager, has done a fabulous job. As we pivoted the company, stood up COVID-19, and in a few weeks, she stepped up and was able to hire molecular scientists to support her efforts. And again, we're running multiple shifts daily to do the volume to meet the demand that the state is. On the in-house side, from a sales and marketing standpoint, our team of people that work out of the headquarters in our home office have been fantastic. I give much credit to our office manager, Jessie Rankin, who's been with me for many years. She runs our accessioning and our data entry process, and then our tech team. They have done an amazing job. We have integrated with Epic, Cerner, and some of the other large electronic medical records that service the health systems across not only South Carolina, but the South or the United States. And our guys are able to do an interface and an API bridge with those EMRs within days. And that's not something that happens quickly. If any of you have ever worked with an EMR, specifically an Epic. So it's just been an absolute pleasure 6 months to see our company grow and expand and pivot. We are just very thrilled to be able to help, provide, state-of-the-art testing lab and services for the state of South Carolina. We are thrilled about our expansion. As you can see this next slide here, we are partnered with some really, really innovative thought leaders and molecular sciences, as well as COVID testing. We're excited to expand the business, and we're excited to continue to hire people and build out our team of talented people, talented professionals. So, I'm honored to be invited to tell our story. It's a great story from the standpoint as, we were in the process of deploying something that we were really excited about. And it was a decision that our Jeremy and our chief science officer were sitting at Ruth's Chris on I think it was a Tuesday evening, and I had just gotten back from Maine. from a deployment at Maine Medical for our perioperative program. And then we were just informed by them that the program was put on hold because of COVID. So we made the decision that evening to transform and pivot the company. And honestly, we haven't looked back since. So it's been a remarkable transition, and it's been really fun to see how the efficiencies of our lab really do impact the patient and employee care.
Nate, thank you, man. We're honored to have you share that story today. It is one of the great wins during a pandemic where a lot of silver linings have emerged, even in the midst of the largest public health crisis that any of us have experienced in our lifetime. So thanks for what you and your team are doing. Appreciated you talking about Jeremy Stewart. You have a fantastic Chief Science Officer and Chief Medical Officer in John Rangel. Jeremy had a lot to do with the growth of Prisma's Cancer Research Institute, formerly called ITOR. So look forward to a couple more questions for you soon, Nate. All right, thank you. And moving on, last perhaps, but definitely not least, Shane Grivich with ChartSpan, which is really, again, another just fantastic upstate South Carolina life science story in what is the most rapidly growing segment of life sciences, the whole digital health IT space. And Shane, I love that story of a couple of people from Houston, Texas, coming to Greenville to participate in an accelerator called Iron Yard and watching y'all skyrocket and create the largest chronic care management firm in the country. So whenever we talk about digital health IT in South Carolina, ChartSpan is that first company that kind of rolls off our tongues and shows what's possible. So thanks for sharing your story now, and look forward to hearing it.
Perfect. Well, you always tell our story pretty eloquently, Sam, so I appreciate it. It's wonderful to be here. I know we're coming up on the top of the hour, and I want to make sure we have enough time for questions, but I'll really kind of go into it. Simply put, when people ask, what is it that we do at ChartSpan? Well, really, we offer care coordination services for patients that are afflicted with chronic diseases, mainly Medicare patients. And really, we're there to help supplement the needs in between office visits. It's a reimbursable code that we offer, and so it means it's the providers can partner with us to provide these services, and allows them to be reimbursed, to help them to do whatever it is they need to do to help manage their disease states. There's really two things. You want to pull up the slides there, and there's really two components that have been really interesting and how it's impacted us. Really, the first was, the operational and logistical impact, and then really how did that marry and affect our clinical application. If you want to go to the next slide. What was interesting for us, if you kind of go back in time to March of this year, at the time we were occupying a 100,000 square foot facility in downtown Greenville, nearly 200 full-time employees at this point. Although we serve patients all over the United States, really our biggest footprint is definitely in South Carolina. And like everybody else, as we moved into March and April and COVID really took hold, we had to figure out what we were going to do. And ultimately, we had to make the difficult decision to have to go to a fully deployed and distributed workforce. Of course, that came with many barriers and concerns, and how could we deploy that many clinicians to go work from home. And when we refer to clinicians, these are everything from CNAs, MAs, dietitians, pharmacy technicians, LPNs, RNs, health coaches. And it was a Herculean task. It took several weeks to complete, and I have to give kudos to our IT team. They did a masterful job. But within 2 or 3 weeks, and since the early part of April, we have worked and operated the company completely virtually. And so in the graphic you're looking at here, put this together recently, and the blue dots really represent clusters of actual clinicians and full-time employees. And so, while we were heavily focused in the Greenville area for obvious reasons, needed to get to and from work, since moving to a distributed workforce, it's allowed us to open up the borders essentially and hire, and train and set you up virtually anywhere in the state. So we're beginning to develop and bring on employees all throughout the state. As far as the actual patients that we serve, these red dots represent clusters of patients throughout the state that we work. I think as of last count, we're at nearly 5,000 active patients here in the state that we provide the services, but we partner with the providers, doctors' offices for these patients. And essentially, we really focus on a lot of the rural areas of the state. As you know, the health system's really do a wonderful job of really covering a lot of urban areas. You mentioned Prisma and Roper St. Francis and some of the others. But there's you have a lot of these counties and areas that have a high Medicare population, but they don't have as much access to the type of healthcare that they need. And that's really kind of, there's been pent up demand for these types of services. And so that's really where we step in, as we partner with a lot of the rural health clinics here in the state, a lot of the federally qualified health centers, independent practices throughout the state, and kind of act as that intermediary between them and the practices and their other providers that they see. If you go to the next slide, Aaron, from a clinical impact, we didn't really know how is it going to affect us. Operationally, we knew this is going to be different. We had to, monitor utilization and quality, and I'm happy to say that both metrics not only stayed consistent with where they were when they were coming into the office, they've actually improved in many aspects. And so that's something that we were pleasantly surprised with. If you go to the next slide, Aaron, the clinical impact, though, is something that has really been interesting for us. I think it'll resonate here with the audience. I won't go through each of these, but you can kind of read them as I talk about it. But these all represent increases and pretty large material increases with what we're doing. What this has really done, to really kind of put a bow on this, is that the pandemic for us has essentially accelerated not only the realization of a need for what we really call electronic delivery of healthcare, whether it's episodic or not, whether it's telehealth or telephonic care coordination like we do, but in my opinion, it's accelerated at 5 to 10 years. It's proven that there's a need for this service, but most importantly, it's proven adoption. Patients are adopting the use of these types of services. We've had dramatic increases in patients now calling, interacting with us, utilizing these services because, for several months, many of the practices they couldn't see. And most of these Medicare patients that are afflicted with chronic diseases were in the highest risk category, so they couldn't go anywhere. So they needed a service like this where they could call somebody 24 hours a day, ask a question, deal with a social determinant issue, or act as a communication component to get communication to and from various providers and patients, all the while creating a revenue stream for providers. And so, over the time from March through the end of August, with the data points you see here, we've had a little over 30,000 patient encounters. But what's really been important for that is that not only has that benefited the patients, it's also generated $1.2 million in revenue that these practices have desperately needed. Their E&M encounters, which is their walk-in encounters when you walk into the office and they see you for a sore throat or an episodic care, has abated dramatically. They closed their doors and now they're beginning to see patients more and more, but they needed that revenue. Really kind of in conclusion, there's really been three really major impact components with the way the pandemic has affected us. It's actually created more jobs for the state. So we're hiring more and more people. We're going to be at probably 160 to 170 full-time clinicians here in the state. So these are jobs for South Carolinians, but these jobs are producing services for South Carolina doctors, which is increasing revenue for them to help keep their doors open and expand their services while serving a patient population that needs it most. And our data is showing us that these services, the telehealth, the care coordination services, are bending the cost curve down. So we're actually reducing the expenditure it takes to treat these patients that have these chronic conditions. So it's really been a unique story for us. Going to a distributed workforce, obviously has been challenging, but I think it's one that we plan to stick with for quite a while. We'll have to see what happens over the next couple of years. I think you're on mute there, Sam.
Unmute, Sam.
Sorry. Got it. Trying to listen carefully, but yeah, it's been great, Shane, to see your evolution for a few years, but even during COVID, and how important your capabilities were for so many patients dealing with chronic diseases who did not have the ability to interface directly with their clinicians. So I know we'll talk about that a little bit more during this Q&A. So we've got a good 20-25 minutes for some questions, and we've got some rolling in, and I'm gonna go ahead and prime the pump with a couple of y'all. And Jennifer, let me talk to you first a little bit about just the uniqueness of South Carolina from an international business standpoint. I think one good point you made, I do admittedly use the term onshoring and repatriation a lot, and that involves, I'm going to say, a lot more than China from our standpoint. And it's not, the way that we're looking at it is simply this. We are so proud that South Carolina is #1 in foreign direct investment, and international business is part of what has built the state and made it such an amazing location, and enhances quality of life, business, everything else. So not in any way do we want to deflect from that. I think our acknowledgement has been just primarily that the fact that 90 to 97% of the healthcare products we're discussing, drugs and API and a lot of medical devices and PPE being made offshore, turned out to be unhealthy for us during this pandemic. So that's an area that we just would like to get a lot more in balance. But you know, in terms of our ability, as we're talking on a session that the European American Chamber of Commerce has helped sponsor, and the International Upstate, talk a little bit about our success as an international landing pad for companies, and that is something that obviously we can build on during this time.
Yes, sure. Thank you. As Sam mentioned, South Carolina ranks in the top for international investment. Some of the other things that you may not know is South Carolina is also the #1 exporter of tires, the highest value of automotive vehicles. We are at the top in aerospace. So it's not just going in one direction. We are making goods for the world here in South Carolina. So that's very important. And, you know, we want to keep building on that. You know, it is a huge undertaking if you're an international company coming into a market where you may have done business, but you don't have any true connections here. It's a huge leap of faith, obviously, and a huge investment. You're putting your company's reputation on the line. So international companies like to go where other international companies are. It makes them feel comfortable, but also lets them know that we have the services and the understanding in South Carolina to take care of them. I think another factor for South Carolina's success is that we have 5 offices overseas, and we do have one in Europe. We've had an office in Europe for over 40 years, a consistent office. We've moved cities a few times, but our current office is in Munich, Germany. So those connections are critical when we're working with companies. And Sam mentioned the term landing pads. You know, this has been a challenge, I think, for economic development organizations who are measured on jobs and investment. How do we help companies get comfortable in the market here, provide them with some resources when some of us are measured on, you know, the volume of jobs and investment? And so the landing pad initiative that Sam mentioned was something that Commerce worked with our regional alliances to really get off the ground so that we could provide some support for companies who might just be sending a sales associate over here, or a customer support person to support maybe a couple of clients they have. So all of those things we do in South Carolina. And thanks, Aaron, for putting my favorite map slide up there, which is the map of South Carolina that shows all the foreign flags, and you see the wonderful concentration that is there in the upstate. So anything else on that subject, Sam?
No, I think you nailed it. And it's, you know, the couple of reinforcing points I'll give is you described the fact that the state has 5 global offices. And ironically, again, some of those silver linings of COVID, where we've all balanced a little more, for the first time ever, we had every single office on a Zoom call that the international division, Amy Thompson, set up in the last 2 weeks. So we're talking offices in Korea, Japan, India, Europe, China. I think I got it.
That's it. You got them.
We're all on at the same time. We've never been able to really do that. And frankly, I'm gonna, on the life science plug side, I'm gonna say they are talking about just unprecedented interest. life science companies looking at South Carolina and seeing that we are a place that they can be very successful in. That international landing pad strategy, there you go. That sort of shows you that breadth of offices around the world. So we're going to continue proudly building our global presence and international business, but we are going to try to balance and bring more life science industries back to South Carolina. I think what's been great for this international business audience is what we learned together, and that's why I'm grateful to Commerce, the culture of collaboration that they brought by sort of grafting SC Bio in and our bullpen of specialists and et cetera, is the bottom line is a lot of these companies, they need assistance that is non-traditional. While they need all the same economic development assistance that any industry would, they are worried about things like FDA navigation, how to get their products and services reimbursed by major healthcare payers on the private side, by CMS. How do they actually engage clinical champions within the healthcare systems, academic researchers, and such? So our job is to work hand in glove with Commerce and the alliances to help bring a lot of that, what I'll call life science special sauce to the table. And we think it's working. It's a great combination. So thank you, Jennifer, for that answer. And then I'm going to ask, we've got a couple of questions that I'm going to also get to that are coming in through chat. So feel free, if you want to introduce a question via chat, please do so. I want to say with Nate, maybe you can talk just a little bit more about what we're learning about this virus. And, you know, as people, one of the questions we're going to get into talks about, you know, testing takes long and getting results. And the good news is I'm glad, you know, we have two companies that are investors of SC Bio that do COVID-19 testing, and you both have 24-hour turnaround, which is fantastic and has really defied that national trend. So hopefully that kind of addresses one of the questions. But as you move into saliva testing and more rapid testing, and you know, Nate, what are the pros and cons of that? What are you learning? And I'm going to ask you to also comment on antibody testing, where the flu virus itself is not being tested, but we're being checked for antibodies, and how much should people rely on results from that?
Okay, so I'll start with the antibody test, if that's okay, Sam. So we're not really a big supporter currently of the antibody technology for a variety of reasons. We just don't believe the quality of that test and what it shows you is really something that's reliable. So there's essentially three tiers of tests that we focus kind of our efforts on. As far as looking at what the advancements in the technology are. The first is what we do every day, and that's the RT-PCR test, which everybody, if you've seen anything on the news, RT-PCR is a platform for real-time process using high throughput instruments to turn around results within 24 hours. Most of the delays that we've seen in the state as well as across the country are mostly supply chain driven. I go back to technology. To have an automated process to be able to get these instruments, to get the results off the instruments, there is human capital that's part of that process from an extraction standpoint for RT-PCR. But reality is the technology is what streamlines it. So integrated to a medical record or a tech platform does create efficiencies to deliver that 24-hour turnaround time. Truthfully, the turnaround time is really about logistics. It's when does it hit you, how many hit you at once, and what's your, when does it hit you? So reality, if you get samples in at 8 p.m. and the lab is pretty much coming down for the day, then you're going to sit overnight because the demand's just not high enough day to day currently that those tests would be run the following morning on the early shift. So that's 10 hours or 12 hours of just downtime that you're just not utilizing. So, and that's just really a demand situation. So if you get them at 8 in the morning, the turnaround time is actually like 4 hours. So it's really just based on some of the logistics associated when you touch the sample, and then how do you get the sample. So I think our average turnaround time since day one with Prisma Health is somewhere in the 26-hour from collection to result. And that includes the transport from Columbia and all their other remote sites. So, and it's really just a technology integration that allows us to do that. And we have a very strong relationship with our Thermo Fisher relationship, which allows us to be guaranteed supplies to make, so if there is a spike or there is an outbreak on a campus, that we can handle 5,000-10,000 tests within a couple of days and still guarantee that level of turnaround. So that's really kind of what we see. So I'll go back though to the other two tests that are part of the question is antigen testing. We think seems to be the next logical test that's out there. One, it's affordable. It does have some reliability. And it has some promises for future, specifically a quick turnaround at the point of care. Antibody test, I think antibody test will advance once there's a reliable vaccine that's out there, and you can start to see some of the different technologies regarding antibody testing. But we would tell everybody, both scientifically and clinically currently, that if you're looking for something to ensure what your employees are either have contracted or have had, and you're relying on antibody testing, we don't think that's strong enough alone. We would recommend an RT-PCR test along with that. And I think that's the best way to rely or to guarantee patient and employee safety. And then the last question I think was around saliva. So saliva is an interesting technology. So if you guys have paid attention to the news nationally, there's a couple of platforms that got momentum in saliva testing initially. The first was the Rutgers platform, which is what we actually based our validation around, just because we thought it had the most accurate data. Saliva, just so everyone is crystal clear, is not as sensitive as RT-PCR. And the reason, the nasal swab RT-PCR. And the reason behind is the variables with saliva collection are so much, there's so many more, right? So what you eat, what you drink prior to getting the collection tube, that matters on what goes in the tube. How much saliva you put in the tube based on the transport media matters. So it's not going to have the same level of sensitivity that you'll see with the nasal pharyngeal swab. Now it's a whole lot more comfortable. I can promise you that, but it is not as reliable at the end of the day. And what I mean, we did a side-by-side, multiple site, all the way from pediatrics to students to varying ages of a dual collection study before we were ready to submit it. And we wanted to be 95% or more. And, we got to around 93% when we submitted and modified our EUA, which our lab director was comfortable with. And the reason we did that is because we could trace on the collection process of those saliva kits that did not give us the data we wanted, that there was a variable that created that. So saliva also is very sensitive to transportation from the standpoint is it does not do well when it's temperature chilled. It actually is recommended that it's room temperature or greater for the best results. So, that's a challenge when we start coming into the winter months about how do you control, transportation from Minnesota to South Carolina when it's very cold, and you have varying temperatures during that transportation. So those are all the variables that we're looking at to really see where this goes. And then the last thing I'd say, Sam, is COVID's going to be very interesting in the fall. And we already are seeing the trend, not just in South Carolina, but a national and a global trend that things are picking up again. And I think the change in the weather and the climates definitely has something to do with it. There's fatigue for sure at the individual level. People are kind of fed up with it. And as mortality rates drop, people's comfort level for being out and doing things becomes greater. Not everybody likes to wear a mask. So, but what we're in the process of validating, it'll be one of the first validated, it'll be a combination influenza A and B and COVID-19 tests. So one collection can give you two outcomes, or at least eliminate two potential outcomes. So, when you see, and we just had this with Jeremy the last week, and he won't mind me telling you this, is Jeremy came in, he looked like hell, and he had the kind of little bit of the chills, the sweats, and he was coughing, and we looked at him and as he was walking into the lab and said, you need to turn around and leave because you don't look good. And it was just, it turns out it's a common cold. So when you have flu, COVID, common cold, and we're coming into crud season, I think we're going to see a lot more need for testing just to rule out what it really is. And hopefully we will see, a stabilization in COVID infections, but the trend we're seeing right now, we're starting to see it rise again.
That's a great comprehensive answer, and I gave you a loaded question with many parts, so thanks, Nate. I think you clarified for a lot of folks, and I learned something every time you address these issues. So again, I think all of us are concerned with the influenza season coming in, and again, a couple of the good questions coming through. SC Bio had really tried to team up as much as possible with all these companies, develop an online emergency supplies portal in conjunction with the Commerce Department's existing industry division, the South Carolina Manufacturing Extension Partnership, and the Hospital Association. We developed relationships with DHEC that we had never had. And Nate, there was a time, and part of the whole onshoring global supply chain issues, again, when you were running out of reagents, you were running out of swabs, as were other companies in the state, and we had to try to do what we could to address that. That was really creating delays for people. The good news is now there's a lot more remote sites for testing all over the state. Mobile units are being deployed and other things like that. But great questions.
Yeah, and there's a question on the chat, Sam, that probably is a good segue. Is that tests take way too long? What can SC Bio do to help coordinate? One of the things that's being organized behind the scenes right now, with including DHEC, but really it's really at the major health institutions, is some type of healthcare information exchange that allows us to say if there is a spike, there is a demand or a outbreak, is how can we communicate across the state with those entities and healthcare providers to know who has capacity and how we can feed to really just drive that efficiency. So we're working hand in hand again with MUSC, who's become a great partner, Prisma. So we're really trying to communicate not just with us as a private lab, but the other lab infrastructure in the state. Is if it gets to a point like we're in the upstate and we're really involved in the Clemson student testing right now. If there's a 10,000 student outbreak in multiple dormitory settings, that's hard for one lab to manage by itself. So the ability to be in touch with, the other private labs across the state or the other healthcare institutions to where we can handle capacity in an efficient manner. That's a big effort that's going on behind the scenes currently.
Right. And life in a pandemic, and we're going to be there for a while. So this is helpful information, and we just got to be resilient and keep figuring it out. I'm going to segue to Shane, and what I'm going to do is also address quickly one question that I think will feed well, Shane, into your area. One of the questions is some new college graduates are having a hard time finding jobs, and I mentioned growth in the job market opportunities. What degrees, experience are there currently opportunities for? It's a great question, and here's the good news. If you just take SC Bio, our small team, for an example, we've had 5 interns. 2 of them that were either in college or recently graduated. 2 of them have been hired as young executives who are doing an amazing job, and they have degrees in genetics, 2 of them in bioengineering, 1 in microbiology. All of these students are as interested, if not more interested, in the business of life sciences as they are being in a lab or going to med school or becoming a nurse or a doctor or any of those great careers. So as you're looking at the what is showing up right now, this is on our South Carolina Life Sciences job board. It constantly on our website, we're advertising jobs from life science companies submitted all over the state. And what you will see as much as anything and learn in this is the incredible variety of talents and skill sets needed to drive this industry forward. It's a very complex industry. It needs great marketing, business, accounting skills, in addition to quality and lab technicians and scientists and clinical experience. So I would encourage our college students that have a variety of degrees. The last thing I'll say on that is Nephron Pharmaceuticals is a good example. They created basically a 2,000 employed biotech workforce from scratch outside of Columbia, where one didn't really exist per se. And what they were really looking for were intelligent, resourceful people who could communicate well, articulate well, right? And for instance, was featured on the NBC Nightly News because they hired 600 public school teachers as part-time employees who had no real background, but were able to do a terrific job. So as I shift to Shane, I'd like for you to even talk about, in your most rapidly growing world of digital health, the kind of employees. Shane, you and I've had a couple of talks about how, one of your bigger challenges is how to successfully enroll patients, and that took skill sets that were not necessarily hand in glove with clinicians. And you saw a whole different level of employee. And I'm going to load you up, since we're kind of running short on time, like I did Nate, and say, I'd like you to also just talk on the fact that if you look at something like telemedicine that went, probably pole vaulted forward a decade in a couple of months during COVID. And so now, opportunities are just unleashed for your segment of the industry. So if you will, talk a little bit about employees and jobs and the growth of digital health.
Sure, certainly. Well, yeah, as I mentioned earlier, you're exactly right. The electronic delivery of healthcare absolutely has fast forwarded 10 years, in my opinion. Patients now were forced to embrace certain technologies, the telemedicines, the care coordinations, telephonic type delivery of services. And when they had a chance to use them and realize they're effective and they're relatively easy to use, in combination of the vendors learning from the behavior patterns of patients to create platforms that are both simple to use for the providers and their staff and simple to use for a mom or a Medicare age patient to quickly log on and use those services. Now that people have experience with those, there's less reluctancy to have that be a normal part of their healthcare delivery system. For us specifically, 4 or 5 years ago, as we were building out our clinical team and our enrollment teams, to do what we do, we had to have certified healthcare clinicians. But unfortunately, as we were growing as fast as we were and really being in the backyard of GHS at the time and Bon Secours and some of the other systems, we were all kind of competing, for certified clinicians. And there just was not enough supply to go around. And it drastically reduced our talent pool. And so good news to the person who sent in the question. One of the things that we did about 1.5 years ago is that we took a step back and we realized, what are the things that we're looking for? It wasn't necessarily the experience we needed clinically, because of what we are doing is relatively new in healthcare. You might find a 20-year RN veteran that ran a CVICU for 20 years, but they might be terrific in that setting. But they're not especially suited for care coordination. Here's an example of our website here that you can go to view our open jobs. So what we did is we which was a tremendous pivot point that our HR team developed, which I again have to give them credit for. But we wanted to expand the talent pool. It was more about identifying people that had certain persona traits, had a hunger to want to get into the healthcare industry, had good active listening skills, could type well, that naturally you're empathetic, good over the phone, which I think encapsulates most, if not, a good portion of the generations coming out of school today. And so we realized that if we could expand our talent pool, and recruit these level of talent, bachelor's degrees and folks that are very hungry to be able to come in, we can get them certified. So we deployed a third-party company to give us initial health coaching certifications. And so essentially you're able to come on board with no healthcare experience at all. We'll teach you the vernacular. We'll teach you what you need to know. Of course, you'll learn about our software and processes and systems, but it'll give you that opportunity to get a nice, full-time paying job with benefits, to be in the cutting edge of kind of what Sam has mentioned, the digital side of healthcare. And we also offer additional services, for instance, at our company, if you want to go and get your RN or your BSN, or you want to get additional certifications or degrees to stick with us to try to keep that talent as part of our company, we offer tuition reimbursements up to complete 100% reimbursement opportunities, that type of thing. So, that was probably the biggest thing that we did was let's open up the talent pool, let's train them on what they need to do, and then let that talent kind of, increase their opportunity here at the company.
No, great answer and great example. So thanks, Shane. And I want to thank all of our panelists. It's been a session where, as always, I learn. I love being surrounded by smart people, and we rely on their expertise and are grateful that this state has such a thriving ecosystem in life sciences and is supported by great economic development partners like Commerce and Upstate Alliance and GADC and Greenville and others. But I mean, there's so much going on, and again, what we have is a bullpen of talent that can be called upon with any variety of projects. And what I can tell those listening in today, the encouragement is they're all awesome at wearing their South Carolina hat first and helping bring their knowledge and giving testimonials of why, you know, whether Shane, it's you moving from Houston, Texas, y'all had no intention of staying in South Carolina. You fell in love with Greenville and you never left, and you're building a global company from there. So that's really exciting. So, you know, some of the other questions that we're rolling through, sorry we can't address them all. I'll hit one in a couple of seconds. It says, are there natural ingredients for pharmaceuticals that can be grown in South Carolina and currently are not a way to tie our agriculture into this market growth? Good news is absolutely yes. And when Jennifer was talking about that amazing Hampton County project that has a lot of bioag research capabilities, and it's year-round indoor farming in greenhouses, no pesticides involved, very sustainable operations, and it's possible that the extractions from many of those natural crops play very much into pharmaceuticals. We have another company that started in that lower part of the state called Growers for Grace that is one of the largest harvesters of blueberries in the country, and blueberries have all kinds of properties. So we're having discussions exactly on this. So a lot of cool stuff. I'm going to finish by thanking very much the World Affairs Council, Upstate South Carolina Alliance, the European American Chamber of Commerce for the Carolinas. And, you know, thanks for allowing all of us to tell our stories today, to talk about the life science industry. And I want to really thank our panelists for making today's event so dynamic. Also want to thank our media sponsor, Upstate Business Journal, who was taping this and covering it. And so it'll be available for distribution. And all of you who took time out of your busy schedules to be part of this, we hope that you'll register for the next supply chain event that's going to be hosted by the World Affairs Council Upstate again, and the same group of sponsors, on October 7th from noon to 1:30. And you can get more information on that at their website, upstateinternational.org. So again, everybody have a great day. Stay safe out there. Wear your masks. It's not a big deal, you know, and let's protect each other. Thank you.